this video I'm going to show you what a bougie is, when you use it, and how to use it. Now, there are a few different sizes. So this is a 15 French, so a little bit bigger, usually for an adult or older child, and then this is a 10 French. In general, you want this to be able to fit through the appropriate size endotracheal tube. This one's just a different style of the adult size. This is called a pocket bougie, so it's a little shorter, a little more compact. But you know what you use really doesn't actually make too much difference. In general, I'm going to go with one of these. They come in a little bit bigger package. Looks like this. Okay. So the bougie itself can be used as an adjunct. So this will give you a little bit more rigid, directable way of accessing the trachea. And the tip, or the part that actually goes forward, has that little bend on it. You can see the other end is straight. Okay. Now these are flexible, so you can curve them if you need to. They don't have a ton of memory, but you can see I can put a bend in and it'll stay. But it's not like a stylet where it has a wire inner core where however you bend that's going to be the way it stays. This has some memory, but not a lot. So when you go to intubate your patient, if you have only a partial view or you're having trouble passing the ET tube, you can go ahead and first pass the bougie. So let's say we're in place and I know I'm in the trachea, then I can take an endotracheal tube or have an assistant do it and come up over the bougie, slide it all the way down, and then you can pass the bougie or pass the ET tube over the bougie. So then you know your ET tube's going to go in the correct spot. Now usually if I'm doing this, I'm going to still maintain visualization with my video laryngoscope so I can still see it passing the cords. But that said, if the bougie is into the trachea, it shouldn't pop out and you should be able to just pass that right through. So that's one of the very nice benefits of this. Now you can also just load up the bougie first, meaning you have the ET tube on the end of the bougie. So that is one option. The other nice thing about a bougie is if you're having to do a cricothyrotomy, the bougie is really nice to pass through into the trachea first because it's nice and rigid, relatively atraumatic. So it does have some advantages in terms of passing that over just trying to get your ET tube in first. The other advantage that some people like is it has that bent tip on the top, and with that bent tip, if it strikes the tracheal rings just right, you can feel a little bit of a vibration, kind of tactile sense that you're in the correct area.